Welcome to the Osteopaths YouTube channel, designed to inspire you to want to look after your body. So today's video is carrying on from our new series, which is looking at what people search for regarding different conditions. And so as an osteopath, I'm going to do my best to answer all of the body conditions that people search through on Google. So today's topic, we are looking at subacromial impingement. So one of the things that someone has searched for are what are the main causes for subacromial impingement. So first off, for people who have no idea what it is pinching and impingement around the front of the shoulder, and it's normally your supraspinatus tendon and your subacromial bursa, which is a fluid-filled sac, gets inflamed around this area and becomes incredibly sore. The main causes, which is what this person is asking, can be lots of different causes. So what we typically see in clinic among desk workers and people that are slumping forward during the day is what you typically do if there's a non-traumatic onset is the shoulders drop forward repetitively over and over. You're narrowing or compressing the bony arch that these structures sit in and pass through. And so what happens over time if we constantly drop the shoulder forward is it starts to get inflamed and aggravated. So that's the first thing. Secondly, if they've got any past history of shoulder issues, so for example, if they've fractured their collarbone or they've damaged their AC joint, typically, if there's damage through these structures, you're going to put more pressure through here, again, where we're dropping forward, so that antalgic posture. And then another cause, just trying to think of another cause that might be, is probably, I would say, trauma to the area. So if anyone's been in any kind of high impact sports, so either rugby where they've gone into the shoulder, or I don't know, throwing sports where you've aggravated around the front of the shoulder, sometimes that can cause the pain. What is the painful arc? So what is the painful arc and how does it relate to subacromial impingement? So when someone comes in to see us in one of our clinics, what happens is we assess your range of motion through the shoulder, and most commonly what we see is when we get someone to bring their arm out to the side and all the way up, in that middle range, so around here, as they're bringing their arm up to the side, is normally where it is the most provoked and the most painful through this area. So we call it a positive painful arc, is when we're testing if the person's struggling to move or they're feeling it in that middle part of the whole arc of movement. What is, or is it a syndrome? So subacromial impingement, is it considered to be a syndrome? And so for me, syndrome is defined as a collection of signs and symptoms. And I would say to a degree that it probably is a syndrome in the sense that when we get impingement around the front, lots of other structures get involved, which is why it's always really interesting when someone comes into clinic, because you can do all the provocation tests and see, okay, there's pain here, but actually as osteopaths, we want to look a little bit more global. You're thinking, okay, this person's got pain here, but actually when we palpate up into the neck and down into the bicep, around the side of the arm, all of that is incredibly tender and tight. And actually, if this is all tight, of course it's going to be impacting pain around the front of the shoulder. And then the final question that someone's asked is, what is the best things to do, or what are the best things to do to treat subacromial impingement? So first thing for me is take down the pain, and this is normally through an ice pack. Is quite effective for the pain with the bursa, and so an ice pack over the area can start to take down the swelling. So think if you're reducing the size of the bursa, you give a little bit of space to that area. Other things of treatment in terms of my hands-on approach as an osteopath, I'd want to articulate and bring the shoulder back and articulate and move, so move up into the neck to get it all relaxed. Open up through the chest so that that person naturally wants to drop their shoulder back. And then finally, I would definitely want to do some strengthening stuff, so I will tag this all in the video to bring the shoulders back, because if we're bringing the shoulders back, this person or the individual that has the symptoms is significantly less likely to drop the shoulders forward. If you enjoyed it, go and check out the rest of our series where we've looked at different conditions and searched this on Google. If you're wanting more precise information on the shoulder, go and visit our shoulder playlist where we've covered all the conditions. Or if you're wanting to find out about other rehab exercises, other conditions and information, then we have so much information on our channel to inspire you to look after your body.